Thank you. UHL Hospital Limerick. 24th of January, 86 on beds. 25th of January, 97. 26th of January, 111. Where's Paul Reid? I know that there are patients that are not being discharged on time. They have not been met to be discharged. What is the cost of the insurance company? I want an audit done to see how many patients in hospital on a private capacity. Patients are being admitted for tests that can easily be done on a daycare case, and they're in the hospital for 4 days. I also want to be addressed the bullying of nurses in the hospital and how many nurses have left this hospital due to bullying by management. The amount of nurses that we have lost in this hospital is unbelievable. And I've asked, not only on this occasion, but on many occasions, it's time now for the management to step down. They failed us before COVID, they failed us during COVID, and now they're failing us now, and they're failing the frontline workers in this hospital.
I welcome this opportunity to address the House on the issues raised by Deputies O'Donoghue, McNamara and McGrath, and I have to say each and every one of you is not your first time raising this. We hear it on a consistent basis. I wish to acknowledge the distress that overcrowded emergency departments cause to patients, their families and frontline staff working in very challenging conditions in hospitals throughout the country. The health sector is facing significant challenges in providing emergency care over the winter period, while also managing the demands of COVID-19. The emergency department in Limerick is one of the busiest in the country, with over 76,000 attendances in 2021, which was up 16% compared to 2020 and up 7% compared to 2019. However, the number of patients waiting on trolleys for admission in UHL in 2021 were 4.7% lower than 2020 and 35% lower than 2019. But still, that's cold comfort to anyone who is on a trolley. The UL Hospital Group has reported that they are continuing to deal with high volumes of patients attending the UHL emergency department, a pattern that has been sustained over a number of months and has been replicated across the country. UHL are working to ensure that care is prioritised for the sickest patients. As part of their escalation plan, additional ward rounds, accelerated discharges and identification of patients for transfer to UL Model 2 hospitals are all underway. Surge capacity has been opened to manage the extremely high levels of activity. There has been and continues to be substantial investment in UHL and the wider hospital group in recent years to address capacity issues, including a new emergency department that opened in 2017. Since the start of 2020, 98 new beds have opened at UHL. This included the 60-bed modular ward block, which became operational in November 2020 and which was established to provide a rapid build interim solution to begin to address the bed capacity issues at UHL and improve patient flow. This also included a 24 single-room bed block, which functions as a haematology-oncology unit, and a temporary 14-bed single-room block designated for confirmed and suspected COVID-19 patients, initiated in May 2020 under the National Action Plan in response to COVID-19. The Winter Plan 21-22 was published on the 15th of November. It builds on the significant investment in last year's Winter Plan. The Winter Plan for 21-22 aims to address the significant combined challenges faced by the health service over the winter period and recognises that a whole system response is required across primary, community and acute care. The scale of these challenges and the demands that our health system faces require both a plan and an associated system of governance and accountability. This system includes leadership, governance and operations to reflect the scale of the challenges faced and investments provided. The Winter Plan sets out the national area and site-level leadership and governance arrangements that are in place. In relation to the question of a review of UHL, HIQA is closely monitoring the overcrowding situation in a number of hospitals, including at Limerick over the last number of weeks, and has had recent correspondence with the hospital group CEO regarding their evaluation of the current factors influencing crowding in the ED. HIQA have also written to the HSE senior management to highlight HIQA's intention to initiate inspections under the national standards for safer, better healthcare. The matter of performance in hospital emergency departments is under constant review by the department through ongoing engagement with the HSE, and the department will continue to closely monitor the situation. So, Deputy, in relation to the question of a review at UHL, HIQA is closely monitoring the overcrowding situation in a number of hospitals, and there's no further details in the response from Minister Donnelly.
Anish, a shock to Richard O'Donoghue.
Minister, and a review by HICWA is a review by the HSE. So that means that the HSE are, there's no such thing as an independent review of the HSE, because it's the HSE auditing themselves. So, and this goes for every case that we've had in the High Courts and everything, it's the HSE investigating themselves. So that's not an independent review. That's people that are within the HSE sector, which are paid by the departments. They are nominated by the ministers to go on these reviews, and they're investigating themselves. That's not a review. I'm sorry. The hospital now introduced a 3-minute assessment for a patient to be assessed. And if a patient gets an extra minute, the management come down and chastise the person that's trying to look after a patient. That's not right either. The management of Limerick University Hospital has to step down and let a new management in there that will actually bring the morale of the hospital up. And it's not frontline workers that are the problem, it's our management. Thank you.
Deputy O'Donoghue, I have to put on the record of the Dáil that HICWA are an independent body, and obviously I know in relation to HICWA dealing with nursing homes and with CNU's community and nursing units and community hospitals all throughout the country, any dealings I have with them, I just need to say that they are an independent body. The Health Service Capacity Review 2018 was clear on the need for a major investment in additional capacity in both acute hospitals and the community, combined with a wide-scale reform of the manner and the location of where health services are provided. Deputy, in relation to your two questions, will the correspondence be published and is a review being considered? I will follow up with that today and try and get you a substantial answer, because it just says, in relation to the question of a review of UHL, HICWA is closely monitoring the overcrowding situation in a number of hospitals, including Limerick, over the last number of weeks, and has had recent correspondence with the hospital group CEO regarding their evaluation of the current factors influencing crowding in the ED. And both deputies, I will bring your concerns to Minister Donnelly. Thank you.